Hi, I'm Shelley Ishie, and today I'm going to present to you a paper on the use of e-learning in medical education. And basically, I have looked at three areas that you can find a multitude of computer-assisted learning, and that is in the patient's interface and for the healthcare workers themselves, as well as for medical education. First of all, we'll take a look at how it's changed the patient. Nowadays, it's not uncommon for hospitals to issue an iPad to patients as they come into the admissions. This would be used they could track all of their testing, when it's scheduled, and be better informed of what they're doing each day and why, as well as their diagnosis. And they also have the ability to look up anything that they might have a question on. And also, they can get answers from the nurses for questions that they might ordinarily not ask because they forget when the nurse comes into the room. So if this reference was to mobyhealthnews.com, which shows that a variety of hospitals have been utilizing this technology. As the generations change and people are more comfortable with computer technology, this will probably grow. It's nice to know what exactly is going to happen to you when you're in an environment where all that control is taken away from you. When they tell you to put on the gown that has no back, then suddenly you have no control. So the other way that you could find the use of computers to help patients would be a study that was done in 2004 and published in the Transaction of the Institute of Measurement and Control and by Rosari. And this was done looking at diabetes control. Diabetes, as you know, is a very deadly disease that plagues a lot of people in this country. Well, they looked specifically at being able to put a watch on somebody, and the watch would monitor their glucose levels, and that level would be sent to a central computing area, and that area would then transmit the information to their physician. So not only could the patient track their own data for when their glucose levels were increasing and decreasing to areas that needed treatment, but the physician could also see how well they're controlling and if there's any habits that could be changed to better control that diabetes. Now, the other area of medicine that is very much in use of the computer technology is for in-service training. The asynchronous ability of the computer programs that are available make it very, very appealing for hospitals to utilize that information to disseminate vital information to their employees. Annual checkups can be done, and they looked at specifically in Vancouver in 2008. Bryce reported that they had a very good outcome with using an infection control study in service. They needed to disseminate this information, and they did so with a computer program that the employees were able to access at their own time when it was convenient for them. This is a big thing for the health field because somebody has to mind the store. You can't have everybody in that area listening to an in-service. There are patients that need attention, and they cannot be ignored. So having that asynchronous ability for not only for weekend shifts and night shifts, but even for in the daytime, to have everybody be able to get the information was very valuable. What they found in the Vancouver study was that the people were very receptive to it. The employees enjoyed it. They were able to utilize their time best by accessing that information when it was best for them. This is a cost savings to the hospital and utilized throughout the healthcare systems. The other area in healthcare for the employees is their annual and continual in-servicing for credits that have to be awarded in order to maintain their credentials. So every year, healthcare employees, no matter what the discipline is, they have to do so much continuing education in order to be considered up to date and with the current standards. The computer technology has created a world where it's not any longer necessary for them to take off for days from work and pay for very costly travel expenses to go and visit someplace to listen to a conference and have that information. They now can access it most of the time for free over the internet and get their in-service training. I had referenced a couple of examples of some interesting ones. One was in 2014 from Rusick, who published his information in the Journal of Traumatic Stress. He did his work with in-service on PTSD, and he was able to show that he had some very, very positive participation from folks and starting to utilize this vital information to get to veterans that were suffering from this. The other article that I had pulled for this example was one on smoking cessation. It was from Tong in 2012, and it was published in the Journal of Women's Health. And it looked at specifically women that were smoking during their pregnancy and postpartum, and it found that up to 28% of women in some states reported that they were still smoking during that period, which is really detrimental to the fetus and infant. So it was a very worthwhile in-service to go through to help people that were dealing with these types of patients to better inform them of all of the available techniques now to help them to stop this cycle, to stop smoking now while you're pregnant, and you'll better the chances for a healthy baby, and you won't expose the baby to that smoke when they come home. So they put together quite the in-service with using the Surgeon General to give a lecture, and they proposed that folks needed to use their smoking cessation clinic. They created a virtual clinic online and engaged the students by letting them wander through the clinic, listening to interviews from specific patients that had stopped smoking, as well as lectures and information and resources that could be given. So they gave the student a little information and a forum to explore on their own, and found that students were very engaged in this program. So in-servicing and continuing education for staff members is definitely a vital part of this computer-assisted learning technology. And as far as medical education, to the student before they reach the job, it has grown leaps and bounds. Most report from the journal, specifically I used mostly the Journal of Medical Education, Adams in 2011, Poisel in 2009, Round in 2009, and Rogers in 2011. They all commented. Rogers in 2011 was from the British Journal of Educational Technology, but they all reported ways to create virtual patients. That's where we are now. These large medical schools now have their own technology sections that are just dedicated to integrating the best technology into medical education. And where are we? We are into virtual reality and creating patients that are virtual patients, and the students using Second Life as a forum can go in and make their avatar however they want, and they had set up a medical clinic in there. Now, if you go to that website, you can see that they'll give you a free trial and you can check it out, make your own avatar, and they also have a section for education. And they created this special clinic with virtual patients. And they allowed nursing students to come in there, make their own avatars, get familiar with the way it was working, and then come in 4 at a time. Now, the key that they used was that everybody in the session had to agree before anything could be done. So in that way, they incorporated collaborative work, teamwork efforts into their virtual world. The beginnings are here, and more places are creating these virtual realities for teaching use. They can cost up to $100,000 to buy a virtual patient scenario. There are places that have put on conferences to train people into how to make these virtual patients. We use clinical case studies to teach medical skills and thinking every day. We use a linear form of that, in that a patient has a disease, we give them symptoms, and you expect the student, because of the symptoms, to pick it up and run with it, treat them the way a traditional treatment would be, and the patient gets well. The computer allows multiple methods for the patient to be treated, which in reality is what happens. Not every physician treats their patient the same way. Not every person thinks the same way, and not every patient responds the same to a given treatment. And so having the ability to change that model around is something that the virtual world gives us that we don't have when we just write a clinical simulation on paper. So all of these methods, the computer world is impacting medicine by leaps and bounds, not only for a patient, which unfortunately as we age we may all experience in some fashion. Our interaction with computers will be integral in our care, and it's also integral in the healthcare worker, as well as educating the future healthcare workers. So I hope that you gained a little bit of knowledge in where things are going in the computer world for health education. I certainly did, and I enjoyed learning about different types of education available, specifically the virtual reality, which I find very fascinating. I guess I was the person that was hooked on Avatar, the movie. So anyway, thank you for your time, and good night.